As thousands of people return home from celebrating the holidays, tonight, healthcare workers are worrying over what's to come for the tripledemic of respiratory illnesses.
McKenna Alexander joins us now with the latest on cases in our area. McKenna?
Yeah, as we ring in a new year, the start of 2023 looks a lot like the end of 2022. As Madison healthcare officials explained that while the rate of COVID, flu, and RSV cases remain steady, they're still much higher than they should be. A new year often brings new beginnings, but for area healthcare systems, last year's problems remain, namely the tripledemic of COVID, RSV, and the flu.
It can be a challenge. So far we've kind of made it without having to do anything, too crazy as far as staffing or replacing patients, but not a lot of wiggle room for us there yet.
Dr. Jeff Potoff, emergency medicine physician and chief quality officer for UW Health, says respiratory illnesses in our community have largely plateaued, but have done so at a rate much higher than normal for this time of year. When it comes to RSV, UW Health reports that cases remain steady, but still above average. For COVID, the number of hospital admissions is also stable, but Dr. Potoff notes an increase of employees calling out sick with it suggests our community may be seeing a bit higher prevalence of COVID-19. Meanwhile, flu cases have come down just a bit over the past few weeks, though the influx of patients remains similar to what it was last month. Among the three viruses, even though the number of new cases remains steady, the sheer amount of patients is what's straining healthcare systems.
A lot of folks who get these respiratory illnesses, they don't get severely ill, but with so many of them out there, even a small percent of people who get severely ill can result in hospital admissions. And that would be one thing if hospitals were relatively empty or weren't struggling with volume. But right now, that is something that not only UW Health, but a lot of hospitals in the area are struggling with, is just really high inpatient census.
That high number of patients is also expected to rise as people now return home from holiday travel.
For a lot of these individuals, those symptoms are more mild to moderate. They might have made a go of it, likely infecting other folks at Christmas dinner or at the New Year's Eve celebration. We'll likely see those cases increase, anywhere from 5 to 7, maybe 10 days from now.
So another factor driving this tripledemic is a lack of people getting a flu shot and COVID booster. Vaccinations that Dr. Potoff stresses not only protect yourself from sickness, but also help busy healthcare systems.